See, we're going live. So I think it's doing the same thing that it said the last time. Setting up your meeting for Facebook Live. Hang on.
It says meeting is now streaming live.
It says it's streaming live.
Okay, great.
All right. Well, good morning, everyone. Welcome. My name is Ali Farouk. I am the Policy Director of Families Forward Virginia, and very excited to welcome you all here to our Parenting in the Pandemic virtual town hall with all of our special guests. And I will pass it over to my colleague, Emily Griffey from Voices for Virginia's Children.
Thanks, Ali. I'm Emily Griffey. Voices and welcome to our town hall on parenting in a pandemic. Hopefully you can find us live on Facebook. We're also going to be recording this and hosting it on our YouTube as well. So just wanted to introduce you to our panel and to Voices for Virginia's Children. Voices is the statewide multi-issue child advocacy organization. You can find us at vakids.org with more information. We've been around for 25 years and we work on a number of children's issues. And most important to children are their parents. So we wanted to ensure that we could talk about parenting in a pandemic today. I'm really excited to hear from our guests. As a parent myself, I feel like we'll have the opportunity to have my telehealth visit with a pediatrician, my virtual home visit with a home visitor, my legislative visit with a delegate. So we're crossing a lot of boxes, checking a lot of boxes for me today. And we're so thankful to have First Lady Pam Northam with us as well. So Ali, your organization and Voices, Families Forward, along with the Virginia chapter of the PTA, took part in a survey of parents earlier on in May. And we, some of our findings were that families are feeling very stressed at this time. They were really concerned about their children's health and safety in a number of settings. They were really concerned about the balance in their life between working from home and being a parent. And parents just really felt like there needed to be some additional policy solutions to help them during this time, as well as just some practical tips that we can feel like they all have the support of being in this together. So that's why we wanted to sort of bring together this panel today and help to address that. Ali, did you want to add anything from Families Forward about the?
Yeah, so Families Forward, as the Virginia chapter of Prevent Child Abuse America, as well as the state office for our various home visiting programs that are visiting with moms and kids and dads and babies during this time, of course, right now virtually, we're really seeing and hearing from parents the services they need, the stress they're under, how they feel like the various institutions of our society just aren't serving them as well as they should be. And so we're very excited to bring all these talented people together and talk about how can we help you all, the parents, raise the kids properly.
Yeah. So if you're following on Facebook right now, please also put in your comments. Our colleagues are going to be including some additional links and resources, some things that our panelists may bring up, some things that we've collected, and hopefully you can get some more information there as well. One of the pieces of information that really struck me as a policy nerd and parent is a survey from the University of Oregon called the Rapid EC Project, where they've surveyed parents during this pandemic and have asked about their levels of stress and anxiety. And of course, it was really high in the beginning. Everybody has been feeling this across the board. And then over the last few weeks, things got a little bit calmed down, except for when they looked at subgroups of parents, Black parents, economically disadvantaged parents, parents with 3 or more children, and found that their stress levels were continuing to go up. That could be some of the Black Lives Matter movement and the stress of revisiting cultural and racial trauma. So we do want to talk about that today. And we also want to look at what might be happening in terms of the stress that parents continue to feel as the pandemic goes on, as we're looking at new stresses around back to school, and just be able to give some advice, some thoughts about how we all manage this together. Ali, over to you. You're muted.
Man, now I have to do it over again. All right, well, we often say it takes a village to raise a child because so many family members, teachers, and professionals, we all work to help create the safe, healthy, loving environment that our children need. And so our elected officials, the village leaders, also have a role to play in responding and prioritizing these needs. And today we want to find out more about how state leaders are responding and which policies need to be addressed in the short term and long term.
Great. So joining us today is First Lady in our order that we'll be going and asking the questions. We have First Lady Pam Northam, Amanda Wheeler, licensed clinical social worker from Child Development Resources in Williamsburg, Delegate Jeff Bourne, who represents Richmond City, and Dr. Irene Machu, who is a pediatrician at UVA Pediatrics in Charlottesville. We're going to start with our First Lady, Ms. Northam, and ask you a little bit about, as you've been such a great leader for children's issues in Virginia, passionate advocate, an educator yourself, a parent, although your kids are older now too. And you really have engaged with so many families across Virginia. So we just wanted to hear from you, hear about what you're hearing. We also know you play a great support role to our governor and the many difficult decisions that leaders and policymakers have to make during this time. So could you share some of the things that the governor's office and others in the administration are working on to help children and families during this time?
I would love to. Good morning, everyone. It's so great to see you all, and thank you, Emily and Ali, for having us today. And I really appreciate that Voices and Families Forward have been such tremendous advocates for our children for so long, and we really appreciate the work that you all continue to do, especially during these difficult times for our children who are most at risk. So we appreciate all that you do, and it's such an honor, my goodness, to be on this panel today with Delegate Bourne and Dr. Mathieu and with Miss Wheeler. So thank you all for having me. I want to start out with another big thank you, and that's to our families out there. My goodness, we challenged you with saying we have to be safer at home. We have to socially distance, wear a mask, wash up, all those things that we've asked our families to do, and you did it. Our community came together. You really responded to our challenge to you, and it's showing. We're one of the few states that is trending down in our numbers and are holding steady on our percent positivity, which means that we're doing very, very well because of the sacrifices that you all have made. We want you to know that we know it has not been easy, and we're working very hard at our level to provide wraparound services to the most of our ability to really help you all in your communities and the great work that you're doing, and to be able to listen. One of the things I know that I appreciate Ali kind of saying, it takes a village to raise a child, but I think it takes a child really to help raise a village as well. Children are so important. We know they're our most precious resource, and it's up to us as a society to care and support them, especially during this time. So really appreciate those of you that are working to do that. Delegate Bourne, who worked with us on some revolutionary early childhood legislation this year to really provide the support structure that's already hit the ground running during this crisis. So really support and appreciate all the work that's been happening. And I appreciate you mentioning equity and social justice during this important time as well. And really, when we wanted to have that discussion about equity, it begins at the beginning with our children, and that's where it all starts. Every child deserves a great beginning in life, and so to support that now more than ever is really, really important to us. Virginia was one of the first states to pull down $70 million from the CARES Act to support our child care and providers. And so we're actually currently still working hard to get that money out to the providers to make sure that they can, provide the services that we're asking them to do during this difficult time. So especially for our essential workers and personnel. Virginia, because we've been working in food insecurity, as you know, with our children's cabinet, and we were able to quickly utilize the pandemic EBT cards to ensure that they're mailed out to every family who has children receiving free or reduced lunches in the schools, which was huge. And also another very important equity issue to make sure that everyone's able to access food in the way that's best for them. Our wonderful Department of Education, my goodness, have teachers and educators and administrators really stepped up to become creative and courageous in this space to support and love their students and children and families. And they produced a 123-page document on spotlighting emotional and social development for our children and learning during this difficult time. I rode a bus with some teachers who took their time. They were doing some really creative online learning things with their own TV channels and fun stuff like that. But then they were spending their personal time riding on school buses to take foods out to the communities where their children, where their students were, to directly make sure that they had what they needed and to check on them because they love and care about them and miss them so much. So that was a real privilege. You know, Medicaid expansion was so important during this administration, and I believe there's been about 32,000 more kids enrolled in Medicaid since March. So getting the health care that children need during this time, especially mental health as well, has been very, very important, making sure that they have those resources. You know, supporting great online learning through partners like VATV, our PBS partners who really stepped up with us, has been important as well. And so I appreciate that. We have many, many partners out across the state who've been working with us to get information out to our families and to our students as quickly as possible.
Thank you for all of those great offerings of what Virginia has done. As hopefully that folks can find more resources as well if they haven't heard. I think we also have links for folks who might need to apply for Medicaid or food stamp benefits. Going to the Common Help portal is a great way to help families. And I know we talked, I think some folks listening today might also be professionals, those who are the essential workforce, you know, working with families. And I just wanted to also give a chance to talk about what are some of the ways that you've been helping the workforce.
Gosh, another important group to thank and to say how much we appreciate their courageous support so that all of us can stay safer at home. We could not do that without all of them being out there on the front lines for us. And, you know, it was important that the state worked to expand the definition of essential workers. Of course, we all know our amazing doctors like Dr. Matthew and my own son and daughter-in-law who are on the front lines of medical care, but also grocery store workers and our wonderful child care providers as well, so that people knew that those folks who really had to be there at work to support our essential workers, as our other essential workers as they went in, we wanted to expand that definition so that they were able to take advantage of all the opportunities that were out there as well in funding and in care. So it was really important to us to make sure that we expanded that definition. We wanted to take that money from the CARES Act and make sure that that was going in the right direction to look at health and safety standards for all those folks to make sure that we're protecting them when we're asking them to continue to work during this time. So we're looking very careful at all that as well. You know, it was interesting. I went and visited several places in our region that were providing essential care and bringing those children in, and they were being so innovative. I mean, how do you socially distance little ones? As you all know, as parents, that's not very easy to do, but they were being so creative. I believe it was the Sprout folks that are so amazing. They actually had hula hoops on the ground for the kids when they were doing some fun outdoors activities, and they really made sure that they showed pictures of everyone with and without their masks so that the children weren't frightened at seeing the masks in their environment. And so many innovative things over at VCU Hospital, where they were really expanding what they were able to do to bring in extra workers so that their children, so that they were able to accommodate more people who were on the ground there. So just many, many wonderful people who are coming to help during this difficult time.
Great. It's so great to hear that you've been able to get out and about and see some of these folks that are providing care during this time. I know you love to talk to parents and early childhood providers and other teachers and find out what they're experiencing. So we do have some parents on the call right now. You know, me, Ali, Amanda, Delegate Bourne, and Dr. Matthew, who sees a lot of kids in her practice, you know, might be able to tell you a little bit about some of the things that we've been experiencing that you might not have heard.
I would love to hear that. As you know, as you said, I my kids are all grown up. They're out there working too. And one thing I would say to, to parents during this difficult time is, you are your child's first and best teacher, and you know your child better than anyone else. So don't lose that confidence in yourself and your parenting during this difficult time. This, is a time for reassurance and comfort, and you're the best people to do that with your children. They love and care about you, and your ability to comfort them during this time and reassure them is great. To empower them to take part and helping out, I think, is really important during this time, and giving them opportunities to be a helper too is a great thing to do. And routines are really important. I learned that with my kids early on, but especially during a time when we feel so unsettled and out of our normal routine, is making sure that we're eating, sleeping, and drinking. And I know some of our experts will talk more about that as well. But as an older parent, I want to say, and we look at silver linings, take this moment to be with your child in all senses of the word, because I know it's time out of our normal lives, but trust me, even during this difficult time, it passes very quickly, and before you know it, they're grown and gone. So take these precious moments, although I know they're difficult, as you said, Emily, when you're trying to wear 10 different hats at once, and it can be super frustrating. But as an old parent, take a little bit of advice and say, take a moment and think about that this special, although difficult time as well. But I would like to hear from you all who do have the children about those special challenges right now. So tell me a little bit about what are those biggest stressors, and Jeff, Delegate Bourne, we haven't heard from you yet. You want to talk a little bit about that? You have such a beautiful
Sure.
family. You want to talk about what's been most difficult for you all?
Well, I think, well, thank you for having me on the town hall, Mrs. Northam. I think the most difficult thing for us, and I know that my problems or my challenges are different than a lot of people's, but having two working parents, especially during the time when the school year was still quote unquote in, my daughter's 12, so she's a little bit more self-directed. My son is 8 and he's a boy. And so we are much more difficult to direct and stay on task. And so that was really challenging when both my wife and I were at home. Both of us would have Zoom or WebEx or Teams meetings, and just trying to hand off or each of the different times when we weren't overlapping with those sort of meetings and calls and deadlines for work, and making sure that we could provide some assistance, some help to our youngest and even sometimes to our oldest. And then I think trying to help our children manage their anxiety and their sort of disappointment and with not being able to have the social interaction, which, as you know, is so critical to child development. Trying to explain to them, why we can't go hang out with friends, why we aren't at school, and those sorts of things. And then I think, and we'll get to this later as I understand, but then when you have the George Floyd and the protests and the Black Lives Matter movement really taking a hold of the country, but obviously most acutely for us, the city of Richmond, especially trying to explain to my son what's going on, and really sort of trying to help him mature probably faster than I'd like him to mature. It's stressful for me and my wife, and so you have this combination of things that you're trying to bring some sense of normalcy to their lives. It's gotten a little better now with our sort of measured reopening. They can go to the pool now and they can do a little bit more activity, and so it's gotten better, but still, I mean, I think there's we'll probably get to this too, but the sort of deadline of Labor Day and schools reopening and what are we going to do, and so it's gotten better, but it's also just gotten different. But I mean, we're trying to make it work, good, bad, or indifferent. We got a puppy during quarantine, so they occupy their time a little bit with that. So yeah, I mean, we're making the best we can, as I'm sure all Virginia families are. But it is a very difficult and sort of unsettling time because of the uncertainty.
It is indeed. And as you said so eloquently, you just hate to see them grow up too fast, right?
Yes.
And dealing with
Yes.
these issues and
Yes.
help our interpretation of those issues to their developmental level is important as well. So I appreciate that. How about you, Emily?
Yeah, well, I have one that's about to enter kindergarten this year and one that's a 2-year-old. And I think for me, one of the realizations is that sometimes I'm getting into some unhealthy habits. And I'd love to hear the advice of Amanda and Dr. Manchu. Like, there's been a fair amount of doom scrolling, like sometimes where cheese and wine are the only answer. And like, like maybe some online rants. And I want to be able to, do all of the best things, but I also know that a lot of parents are just in this together and finding ways to cope. So I'm hoping that we could hear about some healthier habits that I can continue to engage in the future.
Emily, I think a little self-care is really important during this time too.
Yes.
And
Yes.
a little extra chocolate or a little extra, I won't say alcohol, but a favorite beverage in the evening is not so bad as long as we're doing it all in moderation. But it is a
Yes.
difficult time, and finding ways that help you is important to helping your children. Is the old airplane analogy too. It's important to put that mask on for you first before you can care for your children. Anyone else want to talk about some of those particular stressors at this time for them and their children?
Sure. This is Ali Farouk from Families Forward, and I'll just mention, like Emily, I have 2 young kids. One is 3 and one is 6, and it's exhausting. A lot of our families both work full time, and it's exhausting and emotionally draining. Having a 3-year-old is really emotionally draining anyway, and then having a 6-year-old that's competing for your attention with the 3-year-old, it's like a cyclone inside of a tornado, inside of forest fire. And there's a couple things. One is a lot of our families have really adapted by creating our own little sort of quarantine or quarantines, right? And so we're working our best as parents to try and create smaller communities for our kids to socialize and play, which is the most important thing for very young children. But a lot of us are still worried about reopening. We hear, oh, school is really important for kids. I get it, trust me. I would love for my kids to not be at home all day. But more important to me than that is making sure that everything is safe. And so we've heard all the guidance, but I still hear from parents, from my friends and from the parents we serve, there's a lot of questions. There's a lot of skepticism that it's safe enough. And there's a lot of, okay, maybe there's some mounting evidence that the kids are going to be safe, but what about all the staff and all the teachers? They're very worried about that. And on top of all that is just the stress. It's the stress of trying to be present for your child, but also deal with your own emotional anxiety. I live here in the city of Richmond, and seeing the police violence and seeing the violence against Black people and people of color every day has been devastating. One day I was taking my 3-year-old to the doctor, and we drove by the monuments. And on his own, I haven't explained the police violence to my 3-year-old at all. He just pipes out, "Baba, we don't kill Black people." I just started sobbing in the car because I wondered, what has he absorbed and how do I even begin to talk to him about these things? So that's a lot that parents are dealing with.
Yeah, and if I could just echo sort of what Ali has said, I think that the most important decision we can make as policymakers, at least for the next 3 or 4 months, I think is about schools and about our children. And I don't want to get too political at all, but it really disappoints me that we have some, I'll call them leaders in air quotes, who are really bending over backwards to politicize the reopening of schools. And when you think about caring for children, making sure that our teachers and staff and all the decisions that have to go into creating that safest environment for our most precious resource, to have a knee-jerk sort of, open at all costs perspective is short-sighted at best. and dangerous. And so I would just echo that I hear from parents all the time, and um, you know, reopening schools is I you know, I'm still undecided about how I feel. I want my kids back in school because of all the benefits that come with it, but I worry about them. I worry about the teachers and staff, and I worry about the families who might not have the option of staying home with their children, and you know, their situations and circumstances are going to be different, and so that's why it's incumbent upon us as policymakers, when we go back in a special session, to really identify the resources and supports that those families are going to need in the event that schools don't open, or they open on a varying schedule that makes it more challenging for families to be at home and care for their kids.
You know, it's true that our leaders are looking very carefully at all of this, and we want to reassure parents that, you know, the governor, again, as a pediatrician, Dr. Matthew, as you know, uses evidence-based, science-based actual data in his working with his cabinet and other great leaders like Delegate Bourne to make these decisions, and listening to important people who do this work like the CDC and others who have that kind of information. It's very, very important that every step we make to protect everyone in the orbit of our child, including our children, that we do this with an evidence-based format and that we move ahead very thoughtfully. And as you know, just with our phased reopening, that's also what's led us to where we are today, doing the same kinds of things, utilizing the data and making sure that we have the very best information before making those decisions, and utilizing amazing folks like yourselves to help make sure that we're covering all the bases. You know, I appreciate Ali mentioning how difficult it is with a 3-year-old. And one of the things I have heard universally from parents, and we have many on our staff, is a little bit of regression through these stressful times. And I see lots of head nods there that, you know, kids kind of hit the wall. I mean, they're used to being with their little buddies, and it's a cute thing to see them to read a bedtime story together, but it's not the same as playing with your friends. And we know that's so developmentally important. So that's something that I know we've all been struggling with. And I really appreciate what you all have been saying. I want to hear now maybe some words of hope. Is how do you all find hope in this difficult time? Where do you find your silver linings? What would you say to the parents out there that you've learned from your own challenges at home, or what advice would you give them?
Well, I'm not a parent, but I can chime in because I see and interact with a lot of parents every day. And I appreciate you bringing that up, First Lady Northam, because I get a lot of hope from my practice. And granted, I'm seeing kids and parents for 15 minutes here and there, so I can't begin to appreciate all of the stressors that all of you have elucidated and that I know our families are going through every day. But I am hopeful because kids are resilient. And as you mentioned, I think the most important thing they have is you, their parent, on their team, with them 24/7, being that support person. And everyone knows, no one is perfect. Everyone knows that as a parent, you cannot be on and perfect 100% of the time, but just your presence and your consistency is what is going to give that child the skills and the tools to be resilient. And because of kids' developmental stage, and because they are still developing and learning, we know that there's always hope, there's always resilience that they can tap into. So I think that's what gives me hope, is the fact that children are able to bounce back, they're able to thrive, even in adverse circumstances, especially with the support of helpful caregivers like yourselves.
Oh, so well said, Dr. Matthew. Yeah, they're often better than we are at resiliency. Anyone else?
I like to say, I've definitely seen the hope in the work that we do at CDR. It's been so inspirational. We've been able to offer almost all of our services online during this time, virtually. Our support groups, our home visits are virtual. And we've been able to get the family the support they need from professionals, but also from each other. Most of what I've learned through our virtual formats is that parents need each other. They're there for each other. They're probably their biggest support system. And so they were screaming to be able to continue to get together during the pandemic in some way, shape, or form. So we were able to establish our Mothers and Babies program, our Circle of Parents program, which is for children a little bit older, 3 to 5 range. We serve infants and toddlers primarily. So when I say older, I mean 3 to 5. But those parents took those groups and ran with them. They lead those groups. They're facilitated gently by CDR staff, but parents know what resources are available in the community, and they're able to share those with each other. So as far as hope goes, I've been hopeful that parents are able to kind of work through this together. They reach out to us for support. We talk about self-care all the time, absolutely. Put on your mask first, and we heavily emphasize making sure you get your own nutrition, make sure you get sleep too. If you don't have those things in place, you really can't get to a point where you can take care of somebody else. And reminding parents that they are everything their child needs. And I think that really goes a long way with our parents to just remind them that they are doing everything they need to do right now. A lot of our parents were concerned during the protests and then subsequently the riots and feeling, especially some of our perinatal parents, they're in that postpartum period, feeling like I need to be able to do more, but I can't. I'm here with my baby. I want to go do something. And us just encouraging them that you are doing everything you need to do right now for your baby. And so I think just that constant affirmation, those gentle reminders are what's been taking us a long way. So.
Beautifully said. I think supporting each other is really important as well, because no one understands better than those who are in the same boat, right? During this time, and making creative strategies and helping each other find a way forward. Thank you so much for that.
Well, thank you so much, Mrs. Northam. Where I'm happy to be on with this virtual support group today. And I think, we've heard that, legislators, delegates are just like us and have dealing with some of the same stress. So hopefully parents, as they get some advice here, can also just think about how they might connect with their elected officials as well during this time to help share some of the concerns that they have. I do want to turn things back over to Ali to help navigate some questions for the rest of our panel today too. Thank you.
Thank you.
Okay, well, I'm gonna introduce our next panelist, who is Amanda Wheeler. Amanda works at Child Development Resources, which was established in 1965 as a comprehensive resource for parents, teachers, and physicians. They provide a variety of services such as early Head Start, early intervention, and home visiting services. Amanda herself is an LCSW and a graduate of Spelman College and the Washington University St. Louis, where she got her MSW. And she has many specializations, including depression, generalized anxiety, panic disorders, postpartum health, and wellness. And so now Amanda is going to talk about how parents, the help and the support that parents need during this time.
Thank you so much. I like to start out with a few remarks from a parent who is heavily involved in our motherhood program. So just bear with me for a few minutes, but I think that her words were so inspirational and it really describes what we do. So I'll start. Before Neely was born, I did a lot of research on labor and delivery, but not so much on breastfeeding and postpartum. I knew that I wanted to breastfeed, but I just assumed that it was natural and would therefore be easy. Boy, was I wrong. Neely was jaundiced, and we ended up having to check back into the hospital very soon after delivery. My milk still had not come in, and the nurses on the pediatric staff were pressuring me into pumping and feeding him formula through the night. Luckily, it all worked out and my milk came in, but the doctor was still worried about his weight gain and suggested that I would have to supplement the first month or so. I was really distraught because I really wanted to breastfeed, but I also wanted my baby to be getting the right amount of nutrition. I remember seeing someone suggest the group SCDR on Facebook. And one of the ladies at my church also suggested the group SCDR. And my doula suggested that I contact Chris Kiley, all in the same week. So I decided to give it a shot, and boy, I am glad I went. First off, Chris, Kara, and Kelly have always been super helpful with any question that I had concerning breastfeeding, sleep, bottles, and everything else. As a first-time mother, it can be really difficult to know what is normal and what is a problem. Chris right away gave me her number and started getting a plan together to help my supply and help Neely nurse. Aside from all the help that the breastfeeding group gave me with nursing, I was also surprised at the rate at which I built relationships with other moms. Before Neely was born, I did not realize how isolating and lonely the first few months with an infant can be. CDR became my only outlet to socialize and meet new people. In February, I decided to take the Mothers and Babies class, and it was life-changing. Every week, Amanda and the other moms helped me to think about what kind of mom I wanted to be, what kind of spouse I wanted to be, and most importantly, what kind of person I wanted to be for my son. Then COVID hit, and everything was shut down. It was really hard not to have the breastfeeding group or the Mothers and Babies group to go to during the week. It was not just the advice and support that I missed, but also the socialization and relationships that I was starting to build. When Kara reached out to me to let me know that they were going to try and do a virtual support group, I was super excited. In a week, they also informed us that Mothers and Babies class would be brought back virtually. I truly do not know where I would be without the support from the CDR groups. I am so thankful to be a part of such a supportive group of women and mothers. I look forward to a time where we can be face-to-face again. And that's from Vania, a mom to 6-month-old Cornelius, who they call Neely. So I thought that really wrapped up very nicely what we do at CDR from the words of a mom. Now, the Mothers and Babies group that you heard us speak of offers prenatal and postpartum moms a safe place to dialogue about the challenges that are unique to that population, such as infant feeding, sleep, anxiety, parenting, childcare, depression. And although Mothers and Babies follows a specific curriculum, parents really drive the conversation. And they, like I said before, they give an immense amount of support for one another. Early on during the closure, all CDR programs moved to virtual visiting. So that includes our Parents as Teachers program, our Early Head Start home visiting program, our Early Intervention, which is our Part C, often offering virtual therapy for infants and toddlers, our fatherhood, and then our motherhood programs. The virtual visiting was really well received by parents and has really caused us to be more innovative in how we coach parents and how they work with their children. And even within Parents as Teachers, we've been able to provide direct, tangible support to families and even some financial assistance. So again, during these times where employment has been inconsistent for some families, a lot of times they just need practical support. So along with the parent education that always accompany virtual home visits, we've been very much in tune with the practical needs of our families. And again, like I mentioned before, with our Circle of Parents group, it's a virtual group. The parents really drive that group. They always have. We have had that group for about a year now, and straight away from the beginning, that group was met with eagerness and has gained momentum over its duration. So I'm so pleased that, with CDR, with the social distancing in place, we're still able to bring those families together. So.
Okay, awesome. I'm going to check in to see if we've got some questions, but while we're waiting for those, Amanda, can you talk a little bit about, obviously you see parents when they're already under a lot of stress. It's hard to transition to being a new parent. It's hard to transition to have an additional child. And of course, you've seen how parents have struggled as COVID hit and they became isolated. Can you talk a little bit about how, even with all your programs being virtual, how you're able to help them deal with some of that stress? Any tips or you might have for other parents and how to deal with that?
Yes, absolutely. Ironically, at the commencement of Virginia's shelter-in-place phase, the agency was in the middle of an assessment that addresses complex trauma, and staff had just completed a series on the intersections of historical trauma and racism. We realized that in order to support our families, we have to acknowledge and address our own traumas. And so the timing of that, I guess, couldn't have been more perfect. Now, under normal circumstances, many of our families have compounding social challenges, such as economic instability, unemployment, no health insurance or inconsistent health insurance, fears associated with immigration status, interactions with the police. And of course, now they're also faced with the uncertainties with COVID. So in response to this crisis, we've been more diligent about staff development. And we've been engaging more heavily in reflective supervision. So we're being intentional about how we process these events with our staff so that they can be able to work more effectively with the families. Again, we talk a lot about self-care. I talk a lot to parents also about checking in on what's going on out there in the world, but then tuning out when you need to. Really protecting your safe space and making sure that you're well, that emotionally and mentally, so that you can be present for your family. So I think it's important to know what's going on, and that's what we talk about in groups, and that's what we talk about individually. But we also need to know when to kind of tune back and step back a little bit to take care of ourselves and what's right in front of us. Unfortunately, during the pandemic, closures, CDR experienced another trauma when we learned of the sudden passing of two of our beloved coworkers. Words cannot describe the loss that was felt by our community during that time. And naturally, we struggled with responding to families, during that time, and the families that we serve, but also the families of those individuals, and then to each other. And the situation is even more debilitating when we're not able to get together physically and be able to offer support in that more meaningful way. So it's been a trying time, to say the least, but I think our staff has done an amazing job of supporting CDR families while trying to process our own grief. And I'm hopeful that as an agency, we'll continue to move forward in the work that we do with families. We'll continue to train ourselves and to lean on each other for support, get ideas from each other, and how we respond to families.
All right, thank you, Amanda. You brought up how a lot of these stressors are really hurting a lot of our families, and there is a lot of these experiences are traumatizing and cause trauma. So I do want to pull in Dr. Matthew and ask Dr. Matthew to talk a little bit about how should they be dealing with this trauma, and how it might also affect the children, and what are some things that we as a community, as a state, should be doing?
Sure. So, I think that's a great point that Amanda brought up about the idea of complex trauma, that these are issues on top of issues. And even for a family that wasn't dealing with anything pre-COVID, to have the pandemic and then this secondary trauma, which is kind of a secondary pandemic, if you will, of racism and kind of the immediacy of systemic racism, certainly would qualify as complex trauma. And, first of all, I want to go back to, again, what First Lady Northam so eloquently said about really the parent as the antidote to trauma. And, when we look at the literature around trauma and what helps kids heal and thrive in the face of complex trauma, it is having a caregiver, a parent, guardian, grandparent, whoever that person is, but some loving adult who is a consistent presence in that child's life. And I think what that parent can do, again, as First Lady Northam said, is really provide the structure and the safety for that child. So something that I tell my families a lot is that this is a really hectic and chaotic time. Your routines have kind of gone out the window, but what can really help children stay grounded and to heal through and process what's going on is having the structure and the routines as much as possible. So you may not be able to do your full regular school year routine, but if you can at least pick a consistent bedtime and have a consistent bedtime routine, so your child can count on, okay, at 7 o'clock, I'm gonna have my bath and dad's gonna read me my bedtime story. And that's the thing that child can hold on to. And I think that, it comes back to the idea of putting your own mask on before you put on your child's. You've got to do that self-care. And so routines are really good for adults too. I tell people, set limits for your child, but also set limits for yourself. Know when you've got to say no, or you've got to take a break. Know when you have to put away the social media or turn off the news. Because if you can know what your limits are, then you can better, impose those limits for your child as well and be in tune with what your child needs. So I think the most important thing with dealing with this trauma is being that consistent caregiver, which again, just goes back to the self-care first and foremost.
All right, well, I'm going to pass it off to my colleague, Emily Griffey from Voices for Virginia's Children.
Yeah. Thanks, Ellie. I think we're bouncing around a little bit now to our panel because we've heard a lot of some similar themes. I think we've covered some of the great advice from the home visiting perspective, from our pediatric perspective. So we also wanted to bring in our policymaker perspective with Delegate Bourne, because I know people have some questions about what are pieces of legislation that might be under consideration. This is and I also want to make a statement that Voices is a nonpartisan organization, and so is Families Forward. And to us, we see children as a nonpartisan issue. Their health and well-being has been very nonpartisan throughout our 25-year history. And so we come to it from that perspective, is that across party lines, everybody is valuing the health and well-being of children. It has been recently become a more partisan conversation over the last week or so. But I do want to put that in mind and point out that there are some proposals that will likely be on the table for funding additional support for children and families and education this General Assembly session. So I wanted to get Delegate Bourne to weigh in on some of the things that you might think might be on the table for this General Assembly session when you'll come back for the special session. And if there will be an appetite to look at additional funding for children's needs, for childcare, for back to school. What are your thoughts about addressing paid leave or sick leave for families as well?
Well, and Emily, thank you for the question. And while obviously the details of the special session and any legislation are still sort of being massaged and finalized, I think from a general perspective, at least those of us sort of in the Black Caucus that represent a lot of the communities which have been impacted the most disproportionately hard from the COVID, from the racist and racism issues that continue to pervade Virginia. You know, our focus really is on families, children, and the supports that they need. And when we think about children and, you know, we think about school funding, and well, we oftentimes, unless we're reminded, forget that, you know, that also means out of school time. And out of school time could be before school starts and after school ends. But really now we're talking about, you know, potentially having kids in school a week and then off a week, or in school 3 days and off for 2 days. So providing those financial resources for the providers, for the families to find good, healthy, safe environments for their children to be in when school's not in, and when mom and dad still have to go to work, is going to be paramount for us. I think one of the other issues that is really it's at the forefront, but it's not necessarily always tied to supporting children, is the issue of housing and the eviction tsunami that feels like is coming. And some of the data from like RVA Eviction Lab really suggests is making sure that we support families on the housing front too, because there's a few things that are more traumatic than a family being evicted and having to find shelter, and unfortunately oftentimes not. And so focusing on those children resources, the family resources from the housing perspective, but also how do we support the healthcare space and making sure that our families can still have access to the healthcare. We've talked a lot about how healthcare has been provided recently more virtually. We also know that some of our families here in Richmond and other urban areas don't necessarily have access to the most conducive technology to be able to have those virtual visits. And then we think about our rural communities too, where technology isn't really at the same place. And so when you think about the supports that we need to provide for family, it really is a broader conversation, a broad conversation. And I know that at least from where I sit and the people that I sit next to for 60 or 45 days in the General Assembly, we're really pushing the families first sort of aspect of this, from everything from housing to education to childcare and healthcare. And so we look forward to those proposals. Obviously, a lot of this is probably going to be done through the budget, and I have the utmost confidence and respect and faith in the chairman of the House Appropriation Committee, Luke Torian, who who understands keenly the needs of our families. And like the First Lady said, our decisions are going to be made on the data and science and where we can get the um, most value from the investments that we make. And we know that that's investing in our kids and their well-being.
Thank you. That's great to hear. And I'm really glad that you are willing to engage with parents. And so what are some of the best ways that parents can engage with their legislators when we're not doom scrolling?
I mean, even when you're doom scrolling, you might come across a post that I make or some other elected official or policymaker has made, send them a message. That's the easiest way. We check them, our staff checks them, send an email, call the office. I think one of the things that being forced to have more Zoom meetings or WebEx meetings has allowed is allowed policymakers to potentially get to more groups and have more of these meetings, because it's much easier to hit leave meeting and then sign on to another meeting than it is to drive from one part of your district to the other when meetings are happening at the same time. And so, I've been asked this question a lot, and for a longer, sort of more contextualized or more in-depth piece of advocacy that someone wants to do, email is always the best way, because then we can read it, digest it, and offer a thoughtful response. But if you see something that any legislator, any policymaker is expressing on social media and you support it or oppose it, like, use that sort of as an entree into that person's world and say, hey, have you thought about this? Or use that opportunity to respond via email or a phone call and say, hey, Jeff, I saw you posted X, Y, or Z. Have you thought about these aspects of it and tweaking it this way? Because that's one of the things that we're struggling with the most, is really engaging the people that we represent, because we can't get out in person. We're not going to restaurants and bars and community events and all those sorts of things where you might just run into somebody who says, hey, I got an idea. So I think it's using all of the above strategies and ways of communication to engage your policymakers and your legislators.
All right, I do have one quick question that we got from the chat, which is, what are resources available for parents of middle and high school kids so they can identify mental health issues that may be developing in their child and get them the help they need? And so I'll throw that to Dr. Machu, but also open it up to others after that.
Yeah, that's a great question. And it's something that we get very concerned about, because we know that middle and high school students in particular really need the social support of their peers, and not having that and being out of school has been really tough on them. So I would say the first thing is your pediatrician, honestly, because we know that teens and adolescents don't always feel comfortable opening up to their parents and their families, unfortunately. And that's developmentally normal. But sometimes we as pediatricians can do screenings for things like depression and anxiety. We can ask questions in a way that teens may feel more comfortable talking about some of these topics with somebody that they're a little bit less close to than they are to a parent. And so I would say, if you have concerns, bring your child in. It doesn't even have to be, I'm worried about this mental health issue and I'm making a visit just for that. It could just be a checkup, because at all checkups with teenagers and adolescents, we do screenings for mental health issues, for behavioral issues. And so that's going to be part of their normal preventive care. So I would say the first step is to check in with your pediatrician and see if your child is due for a well visit. And even if they're not due, arrange a visit to just kind of check in and see how that child is doing. Delegate Bourne mentioned telehealth and telemedicine. And for those children and families who do have access to video calls or even just phone technology, we have been doing some telehealth with teens. And one of the great benefits of that is, we can talk to the parent, get consent, but then if it's really an issue that the teenager wants to discuss, they can go in their room and we can ask them those confidential questions and figure out what's going on without having to ask the parent to step out of the exam room. And it's really simple and accessible for teens. So I would say those are the first steps. Really just talk to your pediatrician about what care your child is due for and whether or not you could come in for an appointment to just see what's happening. But in terms of symptoms and things that you can be looking out for as a parent, I would say the number one thing is changes in your child's behavior. And everyone's going to have trouble adjusting to the new demands of pandemic life. But looking for things like your child being withdrawn, irritability. Irritability is a big symptom in teenagers. We think about for depression, people being sad and not wanting to leave their room, but teens, it can actually manifest as irritability. Same with anxiety. Teens can show anxiety just for irritability and mood changes. Look for differences in things that they normally would be interested in. If your kid really loves to go running and all of a sudden she's not interested in putting on her tennis shoes or taking a step outside of the house, that could be a sign that something has changed. And then certainly if your child is making any remarks that concern you about their safety or their interest in relationships that used to be important to them, those would be concerns to immediately call your pediatrician about, as well as changes in things like appetite and sleep. So either your child is sleeping a lot more than usual or is having insomnia and not able to sleep as much, and then either overeating or undereating. So I would look out for all of those things. And if you see any of those changes, then definitely call your doctor sooner rather than later.
Thank you, Dr. Matthew. I'm glad we could get that question in from older parents with some older children too. I have found this conversation so helpful for me to think about some better self-care strategies than my doom scrolling. And so really appreciate the opportunity to have, some advice from a virtual home visit, a telehealth visit with a pediatrician, and a legislative visit today. I hope that parents have gotten some ideas about how they can contact folks or look for information. Our organization's Families Forward has many resources of chapters throughout the state that are like CDR in Williamsburg, and support groups that have home visitors and others that can help parents reach out. Our policies have changed around Medicaid coverage for telehealth visits. So all families with Medicaid or FAMUS are able to participate in those telehealth visits, and we have seen that being incredibly helpful and want that to continue in the future as well. And then we'll be gearing up for the legislative session to come in August and to see those difficult budget decisions that the governor or that Delegate Bourne will have to make. And so definitely want to engage parents and advocates and professionals working with families and ensuring that we can get the best possible resources for kids and families in this incredibly challenging time. I do want to wrap up and say thank you so much to this panel today for being a part of our Voices for Virginia's Children and Families Forward panel. Thank you to First Lady Pam Northam. Thank you, Delegate Bourne.
Thank you.
Thank you. Stay well, everyone.
Thank you.
Thank you.
Thank you, Amanda. Thank you,
Thank you.
Dr. Matthew.
Thank you.
Thank you all.
Take care.
Bye.